Hi there, and welcome. Since you're here as part of your evaluation for ADHD, I wanted to put together this little guide for you. My goal here is to just walk you through what this is all about, in a way that's clear and helpful, so you can feel informed and really empowered as we figure out the next steps together. So, let's dive in. It's funny. So many adults I talk to describe their brain exactly like this. It's that constant buzz, right? Just a stream of thoughts, ideas, and distractions all fighting for the top spot. If that hits home for you, I want you to know you're absolutely in the right place. And that feeling? We're going to unpack it together. All right, so here's a quick look at our game plan. First, we'll get a handle on what adult ADHD really is. Then we'll talk about why getting the diagnosis right is so important. After that, we'll dive into the main treatment options, stimulants and non-stimulants. We'll cover how we'll figure out your treatment plan together, and we'll wrap up by focusing on the main goal of all this, which is just a better quality of life for you. Okay, so first things first, let's get down to the basics. What is adult ADHD, really? Because I can tell you, it is so much more than just having a hard time focusing. So in the medical world, we call ADHD a neurodevelopmental condition. That's just a fancy way of saying it has to do with how the brain develops, and it usually starts way back in childhood. It really boils down to this classic trio of challenges. 1, having trouble staying focused. 2, acting on impulse. And 3, this feeling of being constantly restless, either on the inside or the outside. And look, if it turns out you do have ADHD, the first thing I want you to know is that you are not alone, not by a long shot. We're talking about up to 4% of adults worldwide. That's millions and millions of people who are wired in a similar way. So this is definitely not some rare, mysterious thing. It's a really well-understood condition. Okay, so that's the textbook definition. But what does it actually feel like to live with it as an adult? Well, it often looks like a constant battle with organization and time management. Maybe you find it impossible to start that big project, or maybe starting is easy, but finishing feels like climbing Mount Everest. It can also show up as making big, impulsive decisions with spending, with jobs, or maybe it's just really tough to regulate your emotions, your frustration, your excitement. All of this can create real challenges at work and in your relationships. And that feeling, the one where your brain just refuses to switch off, yeah, that's a classic. So here's the thing. A lot of those experiences we just talked about, they can be caused by other conditions too. And that's exactly why the next step has to be a really careful, thorough evaluation. It's all about getting crystal clear on what's going on, so we know we're looking at the right picture. This is probably one of the most important things to get. Just look at the overlap here. Trouble concentrating? Check. Feeling restless or on edge? Check. Sleep issues? Irritability? Check and check. These symptoms pop up in ADHD, but guess what? They're also classic signs of anxiety and depression. It's a real jumble. And this is exactly why you can't just use a simple online quiz. We really have to take the time to untangle all of this to figure out the real root cause. That way, we know we're treating the right thing. So yeah, a proper diagnosis is definitely not a quick checklist. It's more like detective work. We have to systematically go through a few steps. First, we confirm that the full official criteria for ADHD are being met. Then, we look back at the timeline. We have to see that these symptoms started showing up before age 12. Critically, we need to see that it's causing real problems in at least 2 different parts of your life, like at work and at home. And of course, we have to rule out other things that could be causing these symptoms and do a full medical history review, including a heart check, just to make sure any potential treatment is going to be safe for you. All right, let's shift gears and talk about treatment. So if we do confirm a diagnosis of ADHD, the go-to medications, the ones that are the most effective and have been around the longest, are called stimulants. Seriously, these have been used for over 70 years. They have a great safety record, and they're considered the first line or top choice treatment for most adults. Not everyone, but most. So what's the magic here? How do they actually work? Well, a great way to think about it is to picture the front of your brain as a busy traffic controller. In a brain with ADHD, that traffic controller is maybe a little overwhelmed, letting too many cars through at once. Stimulants don't add new roads or cars, they just help the controller do its job better. They do this by boosting 2 key brain chemicals, dopamine and norepinephrine. And when that traffic controller is working more efficiently, you get better focus, more control of your impulses, and a lot less of that internal revved-up feeling. Now, within the world of stimulants, there are really 2 main families. You've got methylphenidate, we'll just call it MPH, and amphetamine, or AMP. They both achieve a similar goal, more dopamine in the right places, but they do it in slightly different ways. Think of MPH as a bouncer at a club door. It stops the dopamine from leaving too soon.
AMP is more like a hype man inside the club, pushing more dopamine out onto the dance floor. It's a subtle difference, but these different ways of working are exactly why one person might do great on one type and not so great on the other.
And that brings us to a super important point, potency. You can't just swap these two, milligram for milligram. They're just not the same strength. A good rule of thumb to remember is that 5 milligrams of an amphetamine packs about the same punch as 10 milligrams of a methylphenidate. This is a really big deal when we're trying to find the perfect dose for you.
So both of these families, MPH and AMP, come in different flavors. You've got your short-acting versions that last maybe 3 to 5 hours. But for adults, who wants to be remembering to take a pill multiple times a day? Exactly. That's why we almost always prefer the long-acting versions. The beauty of these is you take one pill in the morning and you get smooth, steady coverage all day long. We're talking 10, 12, sometimes even 16 hours. It just makes life a whole lot easier.
Okay, but what if stimulants aren't the right fit? Maybe they cause side effects, or there's another medical reason we can't use them. Well, don't worry, because they are not the only game in town. We have a whole other class of medications called non-stimulants, and these are fantastic alternatives. They're also really useful if we're trying to treat ADHD and another condition at the same time.
These non-stimulants all work a bit differently from each other, too. For instance, a medication called atomoxetine can be a real winner if someone also struggles with anxiety. Others, like guanfacine, are awesome if sleep is a problem. We even have an antidepressant, bupropion, that can pull double duty, treating both ADHD and depression. The main point here is that we have a whole toolbox. Treatment is never one size fits all. We can really tailor it to what you need.
Which leads us to maybe the most important part of this whole conversation, your treatment plan. I really want to stress that this is not me just telling you what to do. Finding the right path forward is a team effort. It's a partnership between you and me. Now let's talk about side effects, because they can happen. But I want you to think of them not as stop signs, but as puzzles to solve. For example, if the medicine wears off and you get a rebound where symptoms come rushing back, we can tweak the timing. Trouble sleeping, we can adjust when you take it, try a different medication, or work on your sleep routine. Appetite gone? Taking the pill with food usually helps. Feeling irritable? That might just mean the dose is a little too high or too low, or that we should try switching from the MPH family to the AMP family. The bottom line is, for every common challenge, there's a solution we can try.
The one thing I always ask of my patients is to be patient with this process. Your brain chemistry is totally unique to you, so it is 100% normal if the first thing we try isn't the perfect fit. We might have to try a couple of different options or fine-tune the dosage. The absolute key to getting this right is open communication. You telling me what's working and what's not, that's how we'll nail it.
Okay, so let's just zoom out for a second and look at the big picture. Why are we even doing all of this? I promise you the goal is not just to make some symptoms on a checklist go away. The real goal, it's so much bigger than that. Medication can be a total game changer. It really can. But all the research, and my own experience, tells us one thing loud and clear. It works best when it's not the only tool you're using. When you combine the right medication with skills-based therapy, something like cognitive behavioral therapy or CBT, the results are way better than with either one by itself. The medicine helps your brain focus, and the therapy helps you build the real-world strategies and habits to use that focus effectively. So really, think of it like this. Success isn't just about one thing. It's about building a whole support system. Medication is a huge piece of the puzzle for sure, but therapy and coaching are another big piece. Then you've got lifestyle, sleep, exercise, what you eat, that's another critical piece. And finally, just making sure your environment at home and work is set up to help you succeed. When all those pieces click together, that's when you really start to thrive. So I want to leave you with a question to think about. Just imagine for a moment, what could be possible for you if you had the clarity of a proper diagnosis, a treatment plan that was tailored perfectly to your brain, and a whole system of support backing you up? What could you accomplish? What could you build? Just think about that. Thanks so much for listening.